Root canal therapy is a common dental procedure and is commonly misunderstood or feared by the majority of. It is, however, vital to protect a tooth from removal as well as ease the pain caused by infections or damages to the pulp. In this short video, we'll explore the ways the root canal procedure can save your tooth step by step. Step 1. Diagnosis. The first step towards saving the tooth that requires root canal treatment is to identify the cause. Your dentist will look over your tooth and examine it with x-rays in order to determine whether the tooth's pulp area, comprising blood vessels, nerves as well as connective tissue, is swollen or atrophied. The cause could be severe decay, cracked tooth, multiple dental treatments to the tooth, or by trauma of the tooth. Step 2. Anesthesia. When the root canal process starts, your dentist will give you local anesthesia to help numb the surrounding area of the tooth. This ensures that you feel comfortable throughout the procedure and won't suffer any pain. Step 3. Removing the infected pulp. When you're numb, your dentist will create tiny openings in your tooth that allows access to the damaged pulp. Inflamed or damaged pulp is removed by specially designed instruments. Finally, the root canal is cleaned and disinfected to eliminate dirt and bacteria. Step 4. Filling the root canal. Once the root canal is clean, it's then covered with a substance similar to rubber known as gutta percha to stop any recontamination to the tooth. This substance fills in the root canal and seals it to prevent bacteria from entering and spreading further. Step 5. Restoring the tooth. When the root canal has been treated, your dentist will apply the temporary filling, or a crown, over the tooth in order to shield it until a permanent one will be made. Sometimes dental crowns might be needed to improve the strength of your tooth and functionality. Step 6. Follow-up. When the root canal treatment has finished, it's essential to keep in touch with your dentist on a regular basis for checks as well as examinations. It will help ensure that your tooth heals correctly and that any signs of discomfort or infection can be addressed quickly. The bottom line is that root canal treatments are crucial procedures that will help save your tooth from being extracted as well as ease the pain caused by inflammation or injury to the pulp of your tooth. With these tips and procedures, you will be able to make sure that your tooth is protected and restored to its original state of health. If you're suffering from discomfort in your tooth or believe that there is a need for the aid of a root canal, consult your dentist for a discussion of possible treatment options. It is important to act quickly. Essential to save your tooth while keeping your smile healthy.